Hi, I'm Geoff Mackay. I'm the antimicrobial stewardship pharmacist at Albury Wodonga Health. So I've been a clinical pharmacist for about 12 years at Albury Wodonga Health, and I've been an antimicrobial stewardship pharmacist for about 6 of those years. Antimicrobial stewardship is a whole set of things that are put in place in a hospital to make sure we utilise antimicrobials appropriately. So to minimise the prescribing of broad spectrum antibiotics where they're not indicated, and to make sure we prescribe narrow spectrum antibiotics where they're indicated. So my interest in the research began when my nonna was quite sick with sepsis in an ICU in Griffith, and she wasn't prescribed penicillin because she had a false penicillin allergy label. She just got nausea and vomiting from Augmentin, which is really not an allergy. It's not a true allergy, it's just a side effect, and it would have been quite safe for her to be prescribed penicillin. Because she had that allergy label, she was prescribed less ideal antibiotics, non-penicillin antibiotics, and it took her a lot longer to recover, and she nearly passed away. And from that moment, I've had a personal interest in antibiotic allergies and making sure that we are giving people the access to the best possible antibiotic to help them get better. So I first heard about challenging patients with low-risk penicillin allergies through the Purple Pen podcast, which is the Hospital Pharmacist podcast. And an infectious diseases consultant at the Austin Hospital, Dr. Jason Trebbiano, spoke about how much benefit there is to challenging patients who have a low risk of having a true penicillin allergy. So after the experience with my nonna, I decided to contact the Austin Hospital and just ask them if I could borrow their procedure so I could implement a similar program here at Albury Wodonga Health. At that point, Jason actually invited me to apply to join his program as a regional site. So that led me down the research pathway where I underwent a site-specific assessment and a research agreement and got governance approval, and then got Albury Wodonga Health on as a regional site for this program. I think it's really important that patients, particularly in Albury Wodonga, which is a huge regional centre, are given the same access to patients that are in Melbourne. There's really no reason why patients in Albury can't have low-risk allergies challenged, and that was the whole reason why we did this, because we felt that there was an opportunity to provide a service that previously was only available in Melbourne that we could easily manage here at Albury. Because the program's been so successful in Albury, there's now plans to establish a more broad program. So this program is going to turn into something called the National Antibiotic Allergy Network, whereas basically all of the hospitals in Australia that are now challenging penicillin allergies will report to one centralised place, which will still be the Austin Hospital. They'll still be the lead hospital, but it will now be expanded to far more health services across the country, and I'll also be acting as the principal investigator for that study.